Dr. Singh, what is the difference between conventional and computer-guided dental implants?
Conventional implants are the way we've always done it for the, last 40, 50 years. And that involves cutting the gum tissue, opening it up, peeling the gum tissue back enough to be able to locate the bone, and then visually lining that implant up and placing it within the bone to try to avoid any of the vital structures that might be around there. Computer-guided implants, on the other hand, are based on CT scan technology. So that's a three-dimensional X-ray which can be taken, and then on the computer we can plan the exact position that we want that implant to be before we even touch the patient. That plan is then exported to our partner company in Germany, and they send us a surgical guide. The surgical guide is then placed in the patient's mouth at the time of surgery, and a minimal opening, just large enough to accommodate the implant, is made, and the implant is placed directly into the bone. It results in no incisions, no stitches, minimal bleeding, usually no postoperative bleeding, and minimal pain or discomfort for the patient.